Hello, good evening. Pradeep Pindyala, your buddy. Today I am going to discuss about capnography in brief. Capnography is nothing but monitoring of the concentration or the partial pressure of carbon dioxide in the respiratory gases. Its main development has been as a monitoring tool for use during anesthesia and intensive care management. Usually, it is presented as a graph of expiratory carbon dioxide measured in millimeters of mercury, plotted against time or less commonly and more usually expired volume. The plot may also show the inspired carbon dioxide, not only expired carbon dioxide, it also shows inspired carbon dioxide, which is of interest when rebreathing systems are being used. When the measurement is taken at the end of breath, exhaling, it is called end-tidal carbon dioxide, EtCO2. Well, the capnograph is a direct monitor of the inhaled and exhaled concentration or partial pressure of carbon dioxide and an indirect monitor of carbon dioxide partial pressure in the arterial blood. In healthy individuals, the difference between arterial blood and expired carbon dioxide partial pressure is very little. In the presence of some lung diseases and some congenital heart diseases like cyanotic lesions, the difference between arterial blood and expired gas increases and can even exceed 1 kPa. kPa is kilopascal unit. And normally it is used in anesthesia very often. There is an interplay between two components, the patient and the anesthesia administration device, which is usually a breathing circuit or a ventilator in anesthesia in a ICU or even in operation theater. The critical connection between the two components is either an endotracheal tube, ETT, or a mask. The carbon dioxide is typically monitored at this junction. Capnography directly reflects the elimination of carbon dioxide by the lungs to the anesthesia device. Indirectly, it reflects the production of carbon dioxide by tissues and the circulatory transport of carbon dioxide to the lungs. And when expired carbon dioxide is related to expired volume rather than time, the area beneath the curve usually represents the volume of carbon dioxide in breath, and thus over the course of a minute, this method can yield the carbon dioxide per minute elimination. Obviously, it's an important measure of metabolism. Sudden changes in carbon dioxide elimination during lung or heart surgery usually imply improper changes in cardiorespiratory functions. Capnography has been shown to be very effective as a clinical judgment tool in early detection of hyperventilation or esophageal intubation, thus allowing patient injury to be prevented. Capnography is best utilized. During procedures done under sedation, capnography provides more useful information, for example, on the frequency and regulatory of ventilation than a pulse oximeter. So here it scores even better than pulse oximeter. Capnography provides a rapid and reliable method to detect life-threatening conditions like malposition of tracheal tubes, endotracheal tubes, and unsuspected ventilatory failure or circulatory failure and defective breathing circuits or disconnections in the breathing circuit, and to circumvent potentially irreversible patient injury. Capnography is the best possible preventable tool to avoid such dangerous, irreversible patient injury. So, capnography is a must. Capnography and pulse oximetry together can help to prevent 93% of avoidable anesthesia mishaps. Let me repeat this lovely sentence. Capnography and pulse oximetry together can help in prevention of 93% of avoidable anesthesia mishaps. So that important it is. Capnography is increasingly being used in emergency medical services. These uses include endotracheal tube placement, blind insertion, airway devices. A properly positioned tube in the trachea guards the patient's airway and enables the anesthesiologist to check and confirm the proper placement. So this is very, very useful, and it can avoid blind insertion and wrong insertion and trachea, and a misplaced tube in the esophagus can lead to patient death. So during intubation, this can occur occasionally by even anesthesiologists, well-trained, well-experienced anesthesiologists also. Under circumstances, they can put the endotracheal tube instead of the trachea into the esophagus. But the presence of capnography can guide him within seconds that the tube has been placed into the esophagus rather than the trachea. The American Heart Association guidelines say that capnography indirectly measures cardiac output. Can also be used to monitor the effectiveness of cardiopulmonary resuscitation as an early indication of return of spontaneous circulation. This is the best indicator, ROSC. And a person doing CPR, when he gets tired, that can be reflected easily on EtCO2. The EtCO2 level goes down. The level of carbon dioxide released at the end of expiration falls, and that is an indication that the rescuer is getting tired. The moment the other rescuer takes over, the EtCO2 level goes up. This shows the importance of the rescuer changing over when the external cardiac massage is being taking place. Every few minutes, the rescuer should change as far as possible because they get tired and effective compression doesn't take place, so that may harm in the resuscitative process. A sudden drop of EtCO2 may indicate the patient has lost pulses and CPR may need to be initiated. That's very important. A high EtCO2 reading in a patient with altered mental status or severe difficulty in breathing may indicate hyperventilation. And similarly, a possible need for the patient to be intubated. And similarly, low EtCO2 readings on patients may indicate hyperventilation. Well, it is expected to be used more often now in future in asthma, congestive heart failure, diabetes, circulatory shock, pulmonary embolus, acidosis. I'm sure this will be more and more used in future in such condition just now which I mentioned. It works on the principle, the capnography works on the principle that carbon dioxide absorbs infrared radiation. A beam of infrared light is passed across the gas sample, and the presence of carbon dioxide in the gas leads to a reduction in the amount of light falling on the sensor. And this changes is reflected on the monitor and changes the voltage in the circuit. As I just mentioned, capnography provides information about carbon dioxide production, pulmonary perfusion, alveolar ventilation, and respiratory patterns, and elimination of carbon dioxide from the anesthesia breathing circuit and also the ventilator. The shape of the curve is affected by some forms of lung diseases. Normally, obstructive conditions such as bronchitis, emphysema, or asthma, which the mixing of gases within the lung is affected. This would change the shape of the curve. Conditions such as pulmonary embolism and congenital heart disease, which affect perfusion of the lung, do not in themselves affect the shape of the curve, but greatly affect the relationship between expired carbon dioxide and arterial blood carbon dioxide. Capnography can also be used to measure carbon dioxide production, a measure of metabolism. Increased carbon dioxide production is seen during fever and shivering, and similarly, reduced production is seen during anesthesia and hypothermia. I'm sure this was a useful talk. Thanks for patient listening. Until next talk, until next delivery of my simple and useful discussion of some medical topic. Until then, goodbye. Take care.